so I've been through everything with your new inhaler.
Yeah.
Are you happy with how to use it then?
Yeah,
No,
everything's fine, thank you.
no questions at this stage?
I don't think so, no.
Oh, that's brilliant, I'll just pop it down there. What we do find is actually, I've given you loads of information today, you've got your patient information leaflet. We find that a lot of patients then go home and they start thinking of questions that they wish they'd asked.
Yeah.
And what we can do is we can actually invite you back in the next week or so to the pharmacy so that we can chat through those questions, help you with any problems you're having with the medicine. Is that something you'd be interested in doing?
It sounds like a great idea, but to be honest with you, I've just been off work for 2 weeks with my asthma. That's the reason why I've got the inhaler. So I don't think I can really afford the time to come back, I'm sorry.
I know what it's like when you've been off work and you've got, you know, everyone else's.
I really feel like I need to get back to work and get back into it, so I don't think so, but thank you.
Well, what I would say is, you know you've been off work this time with your asthma. If we can really help you get your inhalers working well for you, it might help prevent you having more time off in the future. And, you know, we are open on a Saturday, if that would be good for you, if you wanted to pop into town and do some shopping and chat it through with us then.
Yeah, I guess a Saturday morning would be better for me. But life's so busy, you know, when you're working full time, weekends are quite precious.
Yeah. Well, the other alternative is I could give you a call, you know, just chat it through on the telephone and maybe see if we could mop up any of your questions or queries that way. Would that fit in better for you?
I guess so, but again, it would have to be a Saturday because I work such long hours.
So if we perhaps gave you a call on a Saturday morning in a couple of weeks, you know, just really to help you, you know, get the most out of your inhalers and, you know, get your asthma really well controlled so that you can do everything you want to do and cope with your work better.
Okay then, yeah.
Is that all right?
Yeah, that's fine.
You know, obviously if you do say anything to me that I might want to share with your doctor or the NHS, we'd need your consent to do that.
Right.
Would that be okay?
Yeah, that'd be fine.
Jill, my dispenser, can take your details down.
Okay.
You know, put your number in our diary, you know, work out the best time to phone you so we don't wake you up on a Saturday morning.
Okay.
And we can go for everything from there. Is that okay?
Yeah, that's fine. Thank
Brilliant.
you.